It's my life. Lazy.
So hello guys, so today I'm gonna teach you on how to perform a perineal flushing or providing a perineal care to our patient. So we knew that perineal care, it involves thorough cleansing of the client's external genitalia, anal area, and surrounding skin. The perineum, it is the space between the anus and scrotum in the male and between the anus and vulva in the female. So this procedure, the rationale for this procedure, it is to improve a normal perineal secretions in others, and it is to prevent infection. It is to render a perineum clean before and after childbirth, as well as any treatment, surgery, or procedure involving a perineal area. So the equipments needed for this procedure are the following. First is the sterile pitcher with a sterile water, and then a sterile sponges soaked in a recommended disinfecting solution, and then the two pair of forceps, and then the bedpan, the rubber sheet lined with a cotton draw sheet, and then the disposable gloves, and then the waste receptacle. So the first step is check to see physician specific orders to be followed. It is to ensure accuracy. Next is explain the procedure to the client. It is to gain client's cooperation. So, good morning, ma'am. I am Nurse Cristel, your attending nurse for today, and I will perform a perineal care. So, what is your name, ma'am?
I'm Krisha May Pierce.
Okay, ma'am. So, it is okay with you that I'm going to perform a perineal care.
Right.
Okay, thank you, ma'am. So, just wait a minute and then we will start the procedure. So, the next thing that you must need to do is to prepare all the necessary equipments needed. It is to save time and effort. Next is provide client privacy. It is to prevent unnecessary exposure to the client. So we have to close the curtains or the windows and also the doors. Next is place the client in a dorsal recumbent position with knee flexed and separated, and then drape the client appropriately. It is to prevent unnecessary exposure of the client. Next is place the rubber sheet lined with a cotton draw sheet. It is to prevent the beddings from getting wet. Next is place the client on the bedpan. It is to prevent any liquids from spilling. Next is clean the perineum. So first we have to pour a sterile warm water over the vulva. It is to avoid discomfort, and some client may feel uncomfortably cold if the solution is not warm. So with the use of sponges held by a two pair of forceps, or with a gloved hands, and soak in a recommended disinfecting solution, we must clean the perineal area gently and thoroughly, and we must use a top-down direction. So these techniques allows a thorough cleansing of the perineum while preventing contamination. So first, then we have to discard the used sponges in the waste receptacle. Next, discard again, and then next. Discard, and then next. Discard, and then next. Then discard, and then next. And the last will be the anus. Okay, discard again. So after that, we will rinse it with a sterile water. It is to wash out the remaining disinfecting solution. And after that, we will dry the perineum using the dry sponges, and then we will apply a perineal pad as needed. It is to ensure client's comfort. Again, use the top down direction. Discard. Then discard. then discard. Discard again. Then discard. And last here. Discard. And then Enos. Discard. And then we will apply a perineal pad. And then the last step is we will return the patient in a safe and comfortable position. It is to ensure the client's comfort. Okay, ma'am. Return ka na ka, ma'am. So after the procedure, we should not forget to do the hand washing procedure. So for documentation, we have to record any complaints of irritation or discomfort in their location. And also we have to record an inflammation or swelling observed, and then the presence of unusual odor and other significant findings, especially to a patient with a indwelling catheter. So that would be all. Thank you.
It's my life. Lazy, 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 lazy.